So I have received so many messages and comments asking me how to get rid of acne. I thought, why not make a video on it and give a detailed answer? So stay tuned. Acne. We all get it. Some are lucky enough not to get it as frequently, but some get it very often. And it is the most common skin problem. So what causes acne? Okay, so your skin actually constantly sheds dead cells. It's like a cycle. When new skin cells are made, old ones shed out. This is a natural way for our skin to breathe and regenerate. Now, some of these dead cells get out of our skin through tiny little holes in our body called pores, which I think everyone hates because they become visible and make your skin look uneven and not so beautiful. And guess what? You're gonna hate them even more when I tell you that these pores are connected to the oil glands of the skin, and when they get clogged with oil and dead cells, they form pimples or acne. Sorry guys, but that's the truth. But remember, not only one factor causes acne. Acne can occur due to a number of factors like hormonal changes, some medications like steroids, cosmetics, or skincare products that clog your skin pores can cause acne. Now, that's a very simplified explanation of what causes acne. But it's going to help you understand what type of acne you have and treat it accordingly. But first, let's see when to treat acne. So we all get acne sometimes, right? But should we all use products to treat acne? Well, a simple answer is no. So if you rarely get acne here and there, let it be, because it's a natural process for your skin to get rid of dead cells or bacteria. So my recommendation, let it be. Well, the right time to treat acne is when it becomes bothersome or when the potential of scarring develops. This can be when severe acne flares suddenly, for mild acne that just won't go away, or when a single pimple decides to show up the week before a special event or wedding. That's painful. So, how to get rid of it? I'm gonna give you 5 tips in this video to help you get rid of these acne or prevent them from forming again. Okay, so here's my tip number 1. Find what suits your skin and then stick to it. Now, despite what popular style and fashion magazines tell you, just know there is no one magic product or regimen that fits all. You have to try different products and see which one suits your skin. And once you find out which one suits you better, then stick to it. Now, when looking for different skincare products for acne-prone skin, the kind of ingredients you're looking for is benzoyl peroxide, salicylic acid, glycolic acid, or retinol. Now, benzoyl peroxide basically works in 3 ways. It kills bacteria, it accelerates the replacement of skin, and unclogs the pores that causes acne. Now, it may cause mild skin irritation, which goes away as soon as you stop using the product, so you can apply it all over the area which has acne. But keep in mind, it's a bleach, so make sure do not get it in your eyes, clothes, or colored surfaces where it can leave white spots which are not pretty at all. Okay, and the second ingredient you should be looking for is salicylic acid, which is great for acne as it assists the breakdown of blackheads and whiteheads and helps reduce inflammation and swelling. And the third ingredient you're looking for is retinol. So retinol basically is vitamin A, which helps unblock the pores through cell turnover. Now, you can easily buy products containing these ingredients, but start with lowest strength of these ingredients, and if that doesn't work, then try higher strength or combination of ingredients, because you don't want to irritate your skin and make your acne worse, right? Also, if you have sensitive skin, use creams and lotions containing these ingredients, and use alcohol-based gels, foam, or sprays only if you have oily skin. Okay, so tip number 2 is exfoliate. Exfoliation is so important, I cannot emphasize enough. But it's important that you do it properly, because proper exfoliation removes the barrier of dead skin cells, clogging your pores on the skin, and uncovers fresh new cells underneath. In fact, this opens the way for moisturizing products to penetrate or sink more deep into your skin, which makes them more effective. In short, a regular exfoliating routine will leave your skin looking fresh and healthy and glowing. Now, if you don't exfoliate, your skin pores easily become clogged with dirt, excess oil, and dead skin cells. Blackheads and whiteheads are actually also more likely to occur if you don't exfoliate. But remember, don't over exfoliate. It's not an everyday thing. Over exfoliation can actually strip your skin of natural oils, leaving it dry, and can cause irritation, as like I said earlier, it's removing the top layer of your skin before it can heal. So you don't want to do it every day. Now you may be thinking, how often to exfoliate? Well, I would say no more than 1 to 2 times per week, because that's going to help expedite skin turnover without causing any skin damage. Alright, so my third tip is hydrate. I guess for those of you who know me, you've often seen me emphasize on importance of drinking water. And here I am again talking about the importance of hydration. Because you know why? Acne in adults is getting more common these days because of busy lifestyle and lack of hydration. Water actually helps the body to flush out toxins while giving you a healthier skin. So drinking ample water actually balances the oil and water content on the skin of your face, and this helps to prevent excess oil and sebum secretion, which means fewer clogged pores and fewer acne. So drink a gallon of water every day to prevent acne formation and get a brighter, fresher, and younger looking skin. Okay, so tip number 4 is reduce excess oil. Now, some skins are normal, dry, or oily, right? And those who have oily skin will agree that excess skin oil is most critical factor for causing acne. And this is because acne bacteria live on our skin, and their growth is more around your oil glands, which can worsen inflammation and pus formation. And this is what causes your acne to hurt sometimes. So what can you do to prevent that excess oil on the skin? Well, use bloating paper. It's easily available on any drugstore and it's very cheap. I guess it's like under $5. So use a bloating paper and pat on your skin that will absorb any excess oil on your skin. Well, what else you can do? You can also apply a thin layer of mattifying gel, or just use a mineral-based loose powder foundation to reduce and absorb excess oil. And a tip for all the girls out there is never leave your foundation as it is. Always set it with the translucent powder or just setting powder, just so it keeps on absorbing all the oils. Also, you want to use an oil-free cleanser, lotion, or any makeup, because that can not only further exacerbate oil production, but it can also clog your pores. And finally, if you have oily skin, you must remove your makeup. Well, I guess that's my recommendation for any kind of skin. You never want to sleep on your makeup, because the makeup is going to clog your pores. You have either oily skin or regular skin, always remove your makeup. But for those who have oily skin, have no exception whatsoever. You must remove your makeup before going to bed, because the last thing you want is your pores to get clogged with makeup and form acne. So when removing makeup, you want to use an alcohol-based makeup removing wipes, or just a makeup remover, whatever you have, and put a toner afterwards to reduce the excess oil on the skin. Now, if you have tried all my 4 tips that I mentioned and nothing worked, then it's probably time to see a dermatologist or your doctor, because you want to find out what is actually causing acne. You want to find out the root cause because it could be a hormonal issue. And if that's the case, then your doctor or dermatologist may recommend medications like metformin or contraceptives to manage the hormonal imbalance, because unless you manage that hormonal imbalance, you can use like all the products in the world, but unless that root cause, which is hormonal imbalance, is controlled, you won't be able to get rid of acne. I mean, even if you do get rid of the acne or bring them at a manageable state using other products, they will come back because you have an underlying issue which you need to take care of first, right? And another medication that's often prescribed for severe cases of acne is isotretinoin, and it's available as a brand name Amnestine, Clarivis, or Accutane. Now, this is going to be a little bit out of context, but I do want to talk about the side effects and warnings of this medication, because this medication is very commonly prescribed for like severe and stubborn acne that wouldn't go away with the use of any other product. So before you start using this product, it's important that you know what you're getting into and you make sure that you know the risks and benefits, okay? So this is a strong oral retinoid, which is like a family of vitamin A and is used for the treatment of severe cystic acne and severe acne that have not responded to other medications or treatments. Now, it's a strictly controlled medication with potentially serious warnings, because there is an extremely high risk that severe birth defects will result if pregnancy occurs while you're taking isotretinoin in any amount. Okay, even for a short period of time. So both men and women have to actually sign a consent form on iPledge to acknowledge that they understand the risks with the use of this medication. And also, women have to take the pregnancy test before they start using the medication. And after the test comes up as negative and they answer all the questions on the iPledge form, then the doctor prescribes the medication, sends it to the pharmacy, and then there is a narrow window in which we can dispense the medication. If that window is passed, the pharmacist cannot dispense the medication by law unless patient gets the pregnancy test again, answer all the series of questions on iPledge, and then the doctor clears that the patient is not pregnant and is fine to dispense the medication. Only then the pharmacist is allowed to dispense that medication. Now, this is something I'm talking about US. I don't know how it works in other countries. I hope it works like that, because like I said before, there are severe birth defects with the use of this medication. So if that's not the case in your country, then make sure you do keep that in mind, that when you use this medication, you're not pregnant or planning to get pregnant in the next few months, okay? Now, as far as the side effects are concerned, it may cause dry skin, dry lips, nosebleeds, fetal abnormalities that I mentioned earlier, and mood swings. It causes a lot of dryness on the skin. So this is what I recommend. While you're on this medication, you must have a chapstick, lip gloss, whatever lip balm you use, and a bottle of water with you at all times, because this is no joke when I say that this medication causes dryness of the skin. It really does. Like, it causes like a cracked skin kind of a dryness, okay? So make sure you hydrate well while you're on this medication. Also, if you are using isotretinoin medication or any cream containing isotretinoin, avoid any products containing vitamin A, because like I said earlier, isotretinoin is similar to a vitamin A, or I can say it's a derivative of vitamin A. Okay, so if you use this product in addition to vitamin A, there is a risk of toxicity. Alright, so there you have it, my 5 tips to reduce acne. I hope you found these tips useful. Leave a comment below which one helped you, and if you have any other tip of your own, do share that in the comment section to help others. Remember, if you don't see improvement or your acne gets worse, then see a doctor. And finally, thank you so much for watching this video. If you liked what I had to say, please give it a thumbs up. Share and subscribe now to stay up to date on new videos on health and pharmacy. I'll see you guys next time. Bye.